Evening, and welcome to this telephone town hall. This is Madeline Dean. I'm the Congresswoman from the 4th Congressional District of Pennsylvania, Montgomery and Bucks counties. I do thank all of you for getting on the call. Just for those of you who are joining us, and please, it's fine that anybody joins us at any time. You're most welcome on the call. Know that the purpose of this telephone town hall is to bring you the most recent and accurate information on coronavirus, or what is known as COVID-19, recognizing that things are not static and things are moving quickly, and recognizing the gravity of this crisis. Joining me on the call, importantly, are state, county, and local leaders, as well as experts and practitioners. I will introduce them to you in just a moment. I thought I'd break this call into 3 parts. The first part, I'll give you a very brief overview from here in Washington, D.C. at the federal level, what we are doing. Second, and I think more importantly, the focus of this call is the people that I've asked me to join me on this call so that they can give us a public health overview and guidance. And third, and even more importantly, we will get to your questions. So that's the breakout of the call. And just to lay this up, we know that this is a very serious situation. Just 2 weeks ago, there were only 15 known cases in the United States, and now, just 2 weeks later, there are more than 1,200. I'm not a medical expert, but fortunately we have some of those on the call with us. So let me begin by just giving you very, very briefly. Here in Congress, I want to encourage you to know that it's clear that there is a bipartisan, and I would suggest a nonpartisan, understanding of the seriousness of this public health crisis that is coronavirus. Evidence of that is the fact that just last week we swiftly passed in the House and then passed the Senate and signed by the President a robust $8.3 billion supplemental bill to drive money to states, to research, to testing, and much more. Tomorrow on the floor, it's literally being debated tonight in rules, will be a robust, I hope, that's what I've argued for, appropriation set of bills to make sure that we here at the federal level recognize the disturbance that this will be to families, to communities, to workers, to businesses, to our children in their schools. And so we will be considering, and I hope passing tomorrow, that legislation. So know that the federal government here in Congress, we are well aware of the seriousness of this situation and taking it with that same sense of seriousness. So let me pivot to the second and more important part of this call, where I've been in touch with many of the people who are going to be speaking with us tonight, and I'll just briefly introduce them, and more importantly, I'd like them to just tell us briefly their background, and much more importantly, what they could tell us to bring us up to date. On the call with me tonight, I'm honored to have these folks with me. Dr. Valerie Arkoosh, she is the chair of the Montgomery County Board of Commissioners. She will give us an update on the county level. Mr. Mark Ross, who is Vice President of the Emergency Management for the Hospital and Health Systems Association of Pennsylvania. Ms. Megan Abbott, she's Director of Intergovernmental Affairs for the Pennsylvania Department of Health. And finally, Dr. Julie Gerberding, who is the Executive Vice President and Chief Officer, Strategic Communications, Global Public Policy, and Population Health at Merck. That's a mouthful. She's an expert from Merck, and very importantly, she is a former CDC director from 2002 to 2009. She will be able to offer us an important set of perspectives. And so with that, what I'd like to do is Val Arkoosh, Chairwoman, and Dr. Val Arkoosh, would you mind leading us off, giving us a short bio on you, and just about 3 minutes. I know none of this is adequate time, but about 3 minutes, so that we could run through all of our experts and government leaders. But could you give us a county update? And thanks for being on the call.
Thank you, Congresswoman Dean. I really appreciate your inviting me to join you tonight, and good evening to everyone who's listening in. I am Dr. Val Arkoosh. I'm chair of the Montgomery County Board of Commissioners. I am a physician and also have a background in public health. And here in Montgomery County, we currently, as of this afternoon, have 9 cases, 9 individuals who have tested positive for the new coronavirus. We are the county with the most cases in the Commonwealth right now. The Majority of these cases have been able to be traced to travel either within the United States or outside of the United States to areas where the virus is particularly active. We really want to reassure the public that this is something that we have prepared for, and that 80% of the people who get this virus will have very, very mild symptoms. What we're asking people to think about is the folks for whom, if they do get this disease, they're at higher risk of more serious consequences. That includes the elderly, people with serious underlying medical conditions, or individuals who are immunocompromised. This disease is particularly challenging for people like that because the coronavirus is a new, unique virus never seen before, and currently there is no treatment for it. This is not the flu, so if you've had a flu vaccine, that doesn't give you any protection, and the medications that are used to treat the flu are not effective for coronavirus. So we're asking people in Montgomery County to really be very thoughtful about where they go. We recommended today that people cancel public gatherings and even large private gatherings, and that we need to come together as a community to protect those that are most vulnerable and put our personal convenience to a second position right now. And with that, I'll turn back Congresswoman Dean, and I should be happy to take questions later.
Thank you very much, Dr. Arkoosh. It really is a valuable and important perspective, and I've had the pleasure of being on the phone with Dr. Arkoosh and the county commissioners all week long on this issue, and I know those conversations will continue. Next, I'd like to ask Mr. Mark Ross, Vice President of Emergency Management for the Hospital Systems Association, to please introduce yourself and offer us your perspective.
Good evening, Representative Dean. Thank you very much for this opportunity.
And feel free, anybody call me mad.
Thank you. Thank you so much for the opportunity to speak to the constituents. As you said, I am the Vice President of Emergency Management for the Hospital and Health System Association of Pennsylvania. We are in partnership and under contract with the State Department of Health to provide emergency preparedness and management activities to all healthcare facilities in the state of Pennsylvania. We provide facilitation, administration, and operational support to the 7 healthcare coalitions across the state of Pennsylvania. These healthcare coalitions, our hospitals, our nursing homes, have been planning, training, exercising together for a number of years under a program called the HPP grant, which Representative Dean supports, which provides for healthcare preparedness around the country. Through that program, the hospitals and healthcare systems in Pennsylvania have been working on things such as weather-related emergencies, disease outbreaks, to make sure that we are prepared to respond to these things. This has continued under the guidance of the Pennsylvania Department of Health to include regularly calls with all of our healthcare providers across the state to give them the latest guidance, to address best practices, to hear their needs, to support them as much as we can, and to respond to this disease in the state of Pennsylvania. We have a robust group actively involved, and I think the key message here is for the constituents to truly follow those good practices, the good hand hygiene, the covering of the cough and the sneezes, the social distancing if you're feeling ill, getting your flu shot, and if you feel ill, to contact your provider and not just go to the emergency department. Contact your provider. If you need that level of care that an acute care hospital can give, they will advise that, and that will help the hospitals respond to any surge in patients so that that appropriate level of care will allow for our health systems to be able to respond to those that do need the care. But we are partnered. We are working as a good cohesive unit. And with that, Representative, I will pause.
Thank you very much. And I'm going to pass it off. I misled the group here. I had the wrong name for who will be representing the Pennsylvania Department of Health, so I apologize. We're going to be joined by Ray Barishansky. Ray, I apologize for not knowing it was you on the call. He is Deputy Secretary for Health Preparedness and Community Protection, Pennsylvania Department of Health. Ray, I'd like to toss it to you.
Congresswoman, there's no apology needed whatsoever. I appreciate the opportunity to be here tonight. I am Ray Barishansky. I'm the Deputy Secretary for Health Preparedness and Community Protection at the Pennsylvania Department of Health. I have Dr. Sharon Watkins, our state epidemiologist, with me as well. I did want to just make a few comments in regard to what the Department of Health has done. So approximately 7 weeks ago, we activated our Department of Health's Departmental Operations Center, or DOC, to allow for enhanced response coordination. Some of the entities that we regularly coordinate with include the Hospital and Healthcare Association of Pennsylvania, including your previous speaker, who we have a very close relationship with, as well as Dr. Arkoosh, as we coordinate with our county and municipal health departments. We've also bumped up some of our testing regarding COVID-19 at the state laboratory by purchasing and bringing in new equipment to increase our testing capability. On top of communicating with HAP and our county and municipal health departments, we do receive regular briefings from the Centers for Disease Control, Health and Human Services, and we've even had outreach from the White House staff to find out what's going on with state health departments and what's going on with boots on the ground. Some of our bureaus, including our Bureau of Public Health Preparedness, have been more than actively engaged since day one on this, and our Bureau of Epidemiology, actually provides symptom monitoring for residents returning from areas impacted by coronavirus. We do that in conjunction with the federal government as well. We've reached out to healthcare providers, to businesses, and even educational providers with information, and we've also reviewed and updated our pandemic plans to assure that we're ready for the spread of COVID-19. As you probably know by now, on March 6th, Governor Wolf signed an emergency disaster declaration to ensure that all the state agencies that are involved with this response have expedited resources we need to continue our focus and to hopefully cut off some of the spread. The Department of Health also provides regular updates via press releases and has regular press briefings as well. I think one of the most important things to remember is that whether it's through our relationship with our county and municipal health departments, whether it's through the other relationships we have, we have prepared for this. Our Bureau of Public Health Preparedness regularly trains and exercises with other bureaus in our department for incidents and events just like this. I have often told people that in situations like this, this is not the time to panic. This is the time to prepare. And I will say one more thing before I finish, and that is, this speaks to the audience, Congresswoman, as opposed to you personally. And to the audience, I say, please only go to those social media sites that are reputable. We would counsel you to go to the World Health Organization, the CDC's website, or even the Pennsylvania Department of Health website. Getting good and accurate information will help you prepare for this better. Thank you.
Ray and Sharon, I thank you both for being on the call. And before I introduce our last speaker, I just wanted to let all of you who are listening in on the call who would like to ask a question to just give you the instruction that I think you were given as you called in, which is if you will press #3. Am I right with that, #3? Okay. #3 to ask a question. And I ask if you would to be brief because we have a lot of people getting in the queue. And also, if you can, try to direct your question to one of the participants on the call, if you can. I recognize you might not be able to do that. We'll jump in. They'll jump in to answer you. But again, #3 to ask a question. Our last expert, and I thank you, Dr. Julie Gerberding, for joining us. She's Executive Vice President and Chief Patient Officer at Merck and a former CDC Director from 2002 to 2009.
Thank you so much, Congresswoman. I have never participated in a constituent call before, and this is the way it should happen all the time. So thank you so much.
Thank you.
I thought that it might be helpful to kind of put this particular outbreak into a broader context because I was the director of the CDC when the first new SARS coronavirus emerged back in 2003. So I have a little bit of understanding about how concerning things like this are when they first emerge and what it takes to really keep the public informed, but ultimately to contain the outbreak. So I will be happy to take questions about that, but I just wanted to make a couple points so people could understand where we are right now. Whenever something new emerges, the first step is, of course, to detect it. We were lucky that that happened fairly fast in China, and with the testing becoming more available, we'll be in a better position to do that kind of detection here in the United States. The second phase is to try to contain it at its source. And by that I mean all of the things that were going on in China to try to basically lock down the society and not allow the virus to spread in China or elsewhere. Of course, it was imperfect and the virus did transmit and leaked out of China, but I believe we did buy some time because of the amazing efforts that went on there, and we've been using that time to better prepare in the U.S. Once it spills over to the extent that it has, and today the World Health Organization stated that we are in the middle of, or at least the beginning of a pandemic, it is important to move beyond trying to stop every single case of transmission, but rather to slow down the spread at the community level. And that's what the previous speakers, your wonderful public health leaders, have been talking about on this call. We are moving across our communities to say, first and foremost, people really should stay home if they're sick with anything that resembles a cold or a virus infection so that you don't have any chance of spreading what you have to someone else. But second, we can reduce the peak of the burden on our health system by all of us taking steps to avoid large crowds, to stay away from situations where we can't really contain the space around us and we have to be concerned about somebody else who might be sneezing or coughing. So that kind of social distancing is very important. And ultimately, the sorts of measures to keep hands clean and to avoid coughing and sneezing in anything but a tissue or your sleeve, they seem old-fashioned and something we might learn in kindergarten, but they actually work and are very important in helping to reduce the spread in the community. So we are working hard to get the message out that people can protect themselves and they can help protect the vulnerable people in our society, particularly the elderly people who are at a special risk for serious disease. But the other part of it isn't just slowing down spread. The other part is making sure that we do balance that with the things we need to do to maintain our services and our safety and the security, and most of all in this situation, our health system. So when we can, we work and we do the same kinds of measures to protect others in their workplace that we would do in any other part of our community. But it is important. I work for Merck, and we are working at West Point, which is in the district. We have many people who live in the 4th District, and we're balancing the need to protect our workers from participating in transmission, but also we make important medicines and vaccines that are necessary for the treatment of people who do get sick. So we have a responsibility to keep those materials going. And people in the fire and police department, the people who keep your lights on, et cetera, all of us need to get the right balance between protecting workers, but at the same time making sure that our society functions safely and securely. The last thing I just want to point out is it's always challenging, especially when something first arrives in the community, because you get bombarded with information and sometimes it's conflicting information, or you're in one community that's handling the situation in one way and one county over they may be doing something different. That doesn't mean that anyone's making the wrong decision. It just means that local circumstances and local requirements do vary fairly dramatically at the beginning of an outbreak. So you can expect differences in how different parts of the county or different communities in our region will respond to this, and that's just exactly the way it should be. I'll just end by saying again, thank you, but also it's thrilling to me to hear from someone who represents us in the federal government, but also the state government and the local government, all really participating in the same conversation, showing the strength of our public health system and how communities come together to respond. So thank you so much.
Thank you very much, Doctor. So we now pivot to your questions, which I think are awfully important, and I thank you. A lot of people have gotten in the queue to ask questions. We'll try to move through as many as possible. For anybody we don't get to, I'd ask you to please go to our website and pose your question, and we will get back to you. We'll talk to the experts, and we'll get back to you and continue the conversation and give you information. My website is dean.house.gov, dean, D-E-A-N, .house.gov. I think I see the first question here from Marlene. And for those asking questions, by the way, again, it's #3 to get in line to ask a question. First question from Marlene.
Dr. Julie, I was wondering, I know we don't have any vaccines or any particular medicines that help with the coronavirus. I was wondering, if someone is hospitalized, how are they treating them?
The most important thing for someone hospitalized, because usually that means they have pneumonia, is to give the kind of supportive care that helps support their airway, oxygen, fluids, and if they develop any additional complications, sometimes antibiotics are required. Many of the patients who are hospitalized don't need critical care, but those that develop the severe pneumonia also can be cared for in the intensive care unit. And of course, in America, we have a much better chance of patients being able to survive even when they have severe disease, because we do have such excellent critical care in our local hospitals. So we can count on our health system to be really able to pull people through. Eventually, the body's immune system makes its own antibodies to the virus, and it will be able to clear it. But sometimes that takes longer than the fragility of the patient, and that is the reason why we do see that some patients die from the infection.
Thank you.
Thank you. We had a question from Ronald, but I think he dropped off the line, but I want to ask his question anyway because I think it's a good place to begin. And maybe Dr. Arkoosh, you could help me here. What are the basic symptoms of the virus? What are people supposed to look for?
Great question. So the symptoms of coronavirus are fever, cough, and difficulty breathing. A runny nose is not really part of this. So, and now that we're moving into spring and people are starting to get allergy symptoms, if your runny nose is your first symptom, that is probably not coronavirus. So fever, cough, and difficulty breathing. Very importantly, if you have those symptoms, we want you to stay at home and call your healthcare provider. It's very important that you not show up without warning at a hospital or urgent center or physician or nurse practitioner's office, because they need to take precautions to protect themselves, to set up an isolation room, just for the good of a hospital or a hospital emergency department, for instance. Now, if you are experiencing symptoms that are severe or feel life-threatening, you should absolutely go ahead and call 911. All of our EMS professionals are ready, trained, they have the proper equipment. They will come get you and get you to the hospital. But if you're not experiencing that sort of life-threatening type of symptom, we really want you to stay at home where you're isolated from others and use the phone as your first outreach. Or some people do have health insurance that provide for telemedicine consults. That would be great too. But the important thing is not to head out and potentially contaminate others without them being prepared to receive you.
Thank you. Our next question is from Cindy. Cindy, you go ahead.
Hi, I don't really know who to direct this to, but to what extent are you notifying possible contacts of people who have been infected with the virus?
I'm wondering if, Val, at the county level, you could tell us what you're doing, and at the state level, we could learn also.
Certainly.
I'd be happy to describe that. So when we get an individual who is called a presumptive positive, that means that they have had a positive test at the state level. Then the sample goes on to the Center for Disease Control, and they recheck it, and then that becomes a confirmed case. But we don't want to waste any time. So as soon as we get a presumptive positive, one of the staff in our county office of public health begins a process called contact tracing. And they call that individual and do an extensive interview of every person or place that they have been since their symptoms started, and if they can remember even the day or so before their symptoms started. And then our employees will call each of those contacts, and they will also call those businesses. So if it is a business, we ask that business to close and do deep cleaning before they can reopen again, and one of our Office of Public Health staff does go by the location and just make sure that everything has been done properly. So, but just friends or coworkers or things like that will get a call from our Office of Public Health, and they will be told that they had a direct contact with someone who's a presumptive positive. The Pennsylvania Department of Health has been a wonderful partner in this work, and in some cases they've been taking the lead on the contact tracing. There's a lot of work involved in this, so it's a partnership between us. So the call could come from either the state or from the county.
Thank you.
Did you want to add to that from the state level?
I was actually going to say I'm not really positive. I'm looking at Dr. Watkins right now as our state epidemiologist, and I think Dr. Arkoosh did such a great job explaining the concept of contact tracing. I'm not positive we have a lot to add to that. Thank you, Dr. Arkoosh. And I would also state that our relationship with the county municipal health departments is a strong one, and we do our best to over-communicate as much as humanly possible.
That's great. Our next question is coming from Cameron.
Hi, my question is in regard to school closure. Some schools have already closed and others aren't closing, and it appears how uneven which schools are closing and which aren't. For example, a student today at Nash Elementary was tested for coronavirus after attending the school, and is currently quarantined, but there's no willingness from the school district to close. So I was wondering if there's any general strategy for school closures, when schools should be closed, and especially as we talk about social distancing and limiting group gatherings.
Matt, I can take that too. This is Val Arkoosh again. So let me explain what's been going on with the schools. It's a pretty fluid situation. So when we do that contact tracing that I just described, if we learn that a teacher or student or a worker at a school has had direct contact with a presumed positive case, then we let the school district superintendent know. And we've been in very regular concentration, have had regular contact, and have had several meetings with the school superintendents. So we let them know what the situation is and who the individual involved is. Let's just say that it's a student. If it's a student that has had a direct contact with a presumptive positive patient, then that student will be asked to leave the school and will be asked to self-isolate for at least 14 days. Then we're asking the school to close whatever division that student was in, or whatever parts of the school that student was in, and do a deep clean. And in some cases, they have been closed for more than one day to accomplish all of that. And then they are able to reopen because unless that student starts to show symptoms and gets tested and is positive, then the people at the school are not considered exposed. So that's why schools have been closing and then reopening. We have not yet had a case of a community spread transmission in a school.
The only, I appreciated that answer. This is Ray from the state. The only additional comment I would like to add on to that is that it's important to remember that as of right now, we haven't had any community spread of the virus in PA.
And I just want to add to that. I'm wondering, Dr. Julie, do you have, from your experience and expertise, do you have any guidance on the school closures?
I think this is one of the things I try to emphasize, that there you will see different things in different schools, and this is a very rational approach for where we are right now in the absence of significant community spread. One of the things about this coronavirus that is, I guess, in a sense, the good news is that, yes, we know children can get infected, but they tend to have the mildest illness. So while they may be sources of exposure or transmission to others as this evolves, they themselves are not at high risk compared to the vulnerable elderly people that I was talking about earlier. So in a sense, that's a blessing because this is a fairly transmissible virus, and we have less concern about the effect it will have on kids. The reason that schools close for longer periods of time, even after there's been decontamination, is really in a more advanced stage of an outbreak when you're closing schools so that children are not in direct contact with each other and they are not contributing to the development of ongoing community transmission. But thankfully, we're not in that situation in Pennsylvania right now, so hopefully we can avoid that. But if that begins to happen, I'm sure that you will see more school closures, and perhaps some of them will stay closed longer.
Thanks. Our next question is from Dr. Karen.
Hi. I'm a private pediatrician for a small private practice, and I would just like some information of what us doctors in small practice should do as far as getting testing now that it's becoming more available in the labs, because it's very difficult for us to procure the positive protective equipment now that a lot of the stuff is on back order, so we're unable to get some of the gowns that we need to do that. So I'm just looking for some guidance there when we are going to be asked to do this testing.
Hi, this is Dr. Watkins from the state, and we are hearing that comment from providers, and in fact, we're hearing that comment from providers nationally. And so I think it's important, if you're not able to do the specimen collection on site, and we understand that many providers are not, to have really worked through your public health jurisdiction, whether that be the state or Montgomery County, to understand which facilities in your area are able to provide that specimen collection and arrange that for you, either to provide courier to the Pennsylvania Bureau of Laboratories or to utilize one of the commercial labs that has come on board.
Okay, thank you.
This is Madeline.
And Doctor, this is Val Arkoosh. Let me give you the number to our health department, because they can help. If you have someone that you think really needs to be tested, we can help. And that number is 610-278-5117.
I want to say that one more time, Val.
610-278-5117.
Great. And in terms of just legislatively, we had an update here in D.C. last week by Vice President Pence, who is spearheading the effort on the behalf of the administration, along with Dr. Tony Fauci and others. In terms of masks, we know we are behind in stockpile and production and stockpile of masks. The supplemental bill that we passed, and I hope we will pass more tomorrow, we'll begin to deal with that. We had some assurance from the administration that apparently 1 million masks are very close to delivery. I certainly hope so. But we need to make sure that we up the test kits and also the masks. That is something that we are behind on. There's no doubt about that. Our next question is from Ricky. Oh, I'm wrong. Ricky's off the line. Next question is from Carol.
I don't know who would answer this question, but I was wondering what the death rate is for people over 60 and the death rate for people over 80. I think it's important that people and families know what they're facing in order that they can, make their plans. I don't know who would answer that.
Well, this is Dr. Julie, and I can sort of speak broadly about this. Unfortunately, we cannot give you the exact death rate, and the reason is complicated, but it's because we are really best able to calculate that on who's in the hospital and has been tested. But the vast majority of people with this infection probably aren't in the hospital, and many haven't been tested. So the death rate of people who have been so sick that they needed hospitalization and have undergone testing is high, depending on the stage of the outbreak, somewhere between 2 and 3%. And the older you are, the higher it is. But that is really an artificial estimate because the less sick people are not included in the proportion. So in other words, we're looking at of sick people, how many die versus of the people who are overall infected, how many die. And in the United States, thankfully, because we're so early in this outbreak, we really don't have enough information to understand what it's going to look like here. We have better care than in many parts of China and other places where this outbreak has been going on longer. So I suspect that we're going to see a lower death rate in the U.S. than, for example, in the early days when this was first breaking in China.
Our next questioner is Stephen. Stephen, did we lose you? Let me move on. Maybe Stephen will come back. How about Raymond? Are you available?
Is there a possibility that the U.S. government will prevent all travel overseas?
I'll take the first shot at that. This is Madeline, the Congresswoman, and then maybe we could get some perspective from the experience of Dr. Julie. I guess there is a possibility. That certainly isn't being discussed at this point, but I have to tell you the real seriousness with which the leadership of the Congress is taking all of this. With the goal, as these experts are talking about, of containing and mitigating as much as possible the spread of this disease. I thought I would share with all of you my personal belief, and it has shifted over the course of our experience this past week. We were in caucus today, and we were briefed by a professor from Harvard, an economics professor from Harvard, talking about the serious economic implications this is going to have. And he said, I thought very aptly, he said, if 1 week ago you had said to me, we're going to be closing down Harvard to our students for the remainder of the semester, I would have said that was ludicrous. And he said they have since done that. 1 week later, they did that, and he said it was no longer ludicrous, it was obvious. So something that seemed so bizarre a week ago is obvious and necessary now. So that's my way of saying I don't know if the government will recommend or attempt to prevent overseas travel. You've seen that Italy has certainly isolated itself, and I know that airlines have stopped flights into Italy. But beyond that, I don't know. I think part of the purpose of this call is to call upon every single one of us to use our common sense and to use all the things we can do to change our behaviors to make sure that we're not a part of any kind of spread. I'm very mindful of it here in D.C. When I get back to the district, we have postponed an awful lot of events because I don't want to put anybody at risk. That's my thought. Dr. Julie, do you have another idea?
Yeah, this is a place where the CDC website can be especially helpful. And if you just Google travel advice and coronavirus, it will take you to the CDC's most updated recommendations about travel. And what they've done is kind of create a layering of advice. So clearly we are still strongly recommending that people avoid all non-essential travel to China and Iran, where the outbreak is still a very high threat. That includes now South Korea and Italy, because similarly there's just widespread ongoing rapid transmission in those communities. For Japan, the recommendation is not for everyone, but if people have chronic medical conditions or are older, they're advised to not travel to Japan right now either, even though there's not as much spread going on in that country. Vulnerable people wouldn't want to take that chance, and so they're advised to defer their travel. The other thing relates to cruise ships, and because we've seen how easy it is to move the virus through a cruise ship based on the experience in the harbor in Japan, the government CDC is recommending that people defer cruise travel right now, and especially those with underlying health issues or those with older age, because we've seen very significant transmission and a number of fatal cases associated with the cruise ship environment. That's a little bit different from air travel, because even though we'll feel closer to people and at higher risk on an airplane, modern airplanes actually have very good air circulation and filtration, and so your risk on an airplane is very low. Also, the airlines have all recently come out with statements about how they're doing extra cleaning and really working hard to maintain the interior of the aircraft in good shape. But as a general rule, if you're someone who's vulnerable because your health is not optimal or because you're older and your immune system might not be as it used to be, avoiding travel right now just makes sense. So I really agree with the Congresswoman to just use common sense. And we're kind of in a, I call it the reset phase, where we're just trying to understand what's going on, kind of pausing, hunkering down a little bit while we figure out what's going to be safe and what isn't going to be safe. And I think over the next few weeks, it'll become clear what is going to be happening here, and we may be able to revise these restrictions.
Our next question is from Stephen.
Yes, hello. Stephen Berta from Lower Providence. My question is, thinking 2, 3, 4 weeks ahead, if the government tells us to stay put, to quarantine, where can we get the supplies, such as basic necessities, water, basic food, if we get to that? Obviously not to panic, fully understand that, but what if it's unavailable?
I think it makes sense for people to make some basic plans and have food and important supplies, medicines, and others on hand, but maybe could the county and state speak to that issue?
Speaking from the state perspective, I believe that that's a prudent maneuver as well. I think that, again, I counsel people regularly, don't panic but prepare. And by prepare, I mean like canned goods, dry foods, water, and making sure you have things like that in your own personal places of residence is exceptionally important at all times. There could be a potential for people who have been infected to actually have to quarantine, and that means that you could potentially be spending time in your place of residence. So preparing for that now would be prudent.
And this is Val Arkoosh. In addition to that, it's very prudent if you have any special needs in your home to prepare for that as well. So, for instance, having some extra medications on hand. All of the health insurance companies in Pennsylvania have waived the 30-day limit for prescription refills, so you can stock up and get a little bit of extra medication. Certainly, if you have pets, if you have babies or anyone in the home that has a specific dietary need, it would be good to stock up on that now. And, you know, we know how to do this. I mean, we prepare for blizzards and hurricanes and all those things here. So, again, it's just those very common sense preparations so that you have what you need just in case you have to stay at home for a few days. It's unlikely that we would be unable to leave our homes at all. I think the way to think about this is to reduce the number of times that you have to leave your home. So, if you're one of those people that tends to go grocery shopping, every day or every other day and just sort of picks up that day's food, think about buying maybe 4 or 5 days worth of food, just so you don't have to leave your home as much.
That's great. Our next question is from Richard. Richard, are you there? Maybe while we try to find Richard again, is Denise available? I think Denise had a question.
Here. Hello?
Denise, go ahead.
Yes. My concern was I have an elderly 93-year-old father-in-law that's in a skilled care nursing home, and my concern was visitation. Will the county stop outside visitation so people won't be coming in and to see I don't know who to ask that to.
Representative, this is Mark Ross. I'll be glad to answer that. We actually today, on a call with skilled nursing homes, pushed the latest guidance, which is restricting visitation to those that are essential. So for the care of your loved one, for the protection of your loved one, the staff that are taking care of them, we ask that you restrict that visitation, that you call ahead, and that if you are, for some reason, essentially need to go see your loved one, to make sure you're well. But the new guidance is to restrict it so that we can keep any potential spread out of any healthcare setting. And that goes for all of the healthcare.
And Mark, I apologize. Was there anything else you wanted to talk about with the random questions that we had, or the important series of questions that we had from the hospital association's point of view?
I think it is that common sense, Representative. It is that social distancing. It's not going into a healthcare setting. If you're ill, it's checking, using technology to visit with your loved one, rather than going in and potentially exposing yourself or the ones that are being cared for or the staff that need to take care of our loved ones. I think that is the imperative message. If we can help to mitigate the spread, then our healthcare system in the region and in the state can respond to those that truly need the care.
And this is Madeline, again, speaking a little bit from personal experience with my mother-in-law in a nursing home. I've been in contact with them, and under the guidelines from Vice President Pence, who across the board they have increased the standards for nursing homes as it relates to coronavirus. But the common sense approach is what I know the nursing homes I'm talking to are taking, as well as the medical scientific ones, keeping patients in their rooms rather than having them collect in or congregate in the halls, asking families to stay back if they think they are at any risk or not well, and some nursing homes are restricting outside visiting. So we know that is certainly one of the most vulnerable populations, and we hope we can keep it away from nursing homes in our area and, of course, across the country. Our next call, or question I should say, is from Rahima.
Yes, hi. Hi, this is Rahima from Windcoast. Me and my family was talking about, because we live in a gated community, is it airborne? Like, can we get on the elevator and somebody possibly have it? We're not touching the knobs at this point, but yesterday someone did get on the elevator and you could tell they were very sick. So we were like, well, is it airborne? Is it something that you can actually contract just by getting on or getting near a person that may have it?
Good question. Doctors?
So this is Arkoosh. The virus has passed through respiratory droplets, like when you cough. So that is why there's several very important preventive measures. One is we're asking everyone to work as hard as they can to keep their hands clean. So keep hand sanitizer with you and wash your hands frequently with soap and water for at least 20 seconds. Also, don't shake people's hands. Don't hug people that you don't know well or where they've been. And try not to touch your face, which is almost impossible. But if you do get the virus on your fingers and then you scratch your lip or your nose, the virus can get in that way. What's recommended is to stay 6 feet away from people, like if you're in a line or that type of thing. And when it comes to something like the elevator buttons or door handles, we aren't 100% sure. As you've heard on this call, this is a new virus, and we believe that the virus will stay alive on a surface like a countertop or a doorknob for some amount of time, but it's not really known how long that time is. So, if you can use your elbow to press the elevator button and do some things like that, that's certainly recommended.
Yes. Thank you.
Our next question is from Rachel.
Heard that there's a presumed positive case here. Oh, sorry, am I live?
Yes, start your question again. I'm sorry.
Sorry, that's okay. So I live in Cheltenham, and I have heard that there's a presumed positive case here. So I was wondering if that could be confirmed, and also what are the towns in Montgomery County where there are either presumed positive or confirmed positive cases?
This is Val Arkoosh. Yes, you are correct. There is a presumptive positive case in Cheltenham Township. And I'm glad you asked about where to go to get more information. The county has a data hub that has been up since the weekend, and you can get to that by going to montcopa.org. So that's montcopa.org. And about halfway down the page, that's our county homepage, you'll see something that says Coronavirus Update. If you click on that, that will take you to our data site, which is being updated at least once a day. And also you'll be able to see a map on that page of the townships where we have presumptive positive patients. And then there's a whole host of resources right there on that page. Symptoms, preventive suggestions, what you should have in your home if you want to prepare, links to advice for employers, for schools, all sorts of things. And it is really an extremely up-to-date and a very valid source of information.
That's really helpful. We will keep our website up to date for you also, and also please send in any questions that you have. So please be sure to visit my website as well as we update things. As we're waiting for the next caller in the queue, I did want to add something. Some of the legislation that we are putting together really in emergency fashion today, tonight, and will vote and I hope pass tomorrow, deals with some of the other incredible rippling effects that this will have. Whether people are going to be paid when they need to stay home, so paid sick leave, paid family leave. What do businesses do when they have employees staying home? We need people, if they are sick, as these experts have said, to stay back, to stay home. But we know that many people either don't have the insurance or don't have the paid leave through their employer. Some of the emergency supplemental bills that we are going to be passing tomorrow will deal with those issues and will offer stimulus in order to make sure that folks have coverage for sick leave, for family leave, importantly also for food, for the SNAP program, for the WIC program. We want to make sure that if schools have to close, and some children, many children, are dependent upon schools for There are 2 meals a day that we make sure that these children have adequate food, that families have adequate food. We're also looking at businesses and making sure that we are supporting businesses and businesses are supporting us in dealing with this crisis. And so supporting business owners, particularly small business owners who may not have the flexibility and the cash to support folks staying home and paying them. We as a government, at least I know in our caucus, we believe very strongly that we have to support businesses, families, children for food and for income because this can have devastating economic effects across our country. With that, let me see who is next. Gary? Our next question is from Gary.
Yes, my name's Gary. I'm a veteran from MAD, your district. My question is, when's there going to be mass testing available? Because I know people could be asymptomatic and have it. And I'm afraid to leave the house. I went to the VA the other day, and it was like a minefield. People were coughing, and I got kind of concerned. So my question is, when's there going to be a lot of testing so we can isolate the different communities where people have had it?
Great question. I know that, as I said a little earlier on the call, as a nation, we are behind in having the testing available. We're working with different labs in our county and other communities to see how we can be a part of ramping up the access to testing, but maybe the state, could you help us there in terms of testing, and then we'll throw it to the county.
Thank you.
From the state perspective, I'll let you know that our experiences are exactly parallel to yours as well. We are coordinating with federal entities regarding increasing our number of testing kits available. We've also had communication with private laboratories as well as recently as today with at least 2 private labs who are ramping up their testing as well. And we, similar to what you said about the federal government experiencing some slowdown in that regard, that unfortunately does impact state testing, but I want to be very clear when I say we have no backlog of tests in Pennsylvania.
Val, did you want to add to the testing, and also Mark from the hospital's perspective? And Gary, I do want to say to you thank you for your service, and your question is really important. We have had other veterans call with that exact same question. So Val and Mark.
Seeing that the doctor may be busy, I will jump in on the hospital perspective until Val can get back. We do need to comment. The Department of Health has increased their lab capability since being approved to do these tests. It has been remarkably helpful, and I will reiterate the Deputy Secretary's comments that there is no backlog. We are pushing in order to help to try to get some of our facilities approved to be able to do that testing, and we also absolutely support the private testing companies coming on board to help take some of the burden off of the public health and health system labs as we move forward with more testing in the general public.
And this is Val. I don't have anything else to add to that. I'm just Secretary Levine and Governor Wolf, as well as the CDC and FDA, have been working very, very hard to increase the capacity for testing in Montgomery County, and we're grateful for that support.
And mindful of everybody's time, and I thank everybody who called in and the participants on the call. We're going to have 2 more questions, one from Lisa and one from Neil, so I'd ask you both to hang on, and then just some very quick closing comments. Lisa, you're next.
Yes, good evening, everyone. I have a question regarding the 180 days that public school children are required to attend. Several hours ago, a child was identified in our school district up here. They are not going to close. They're concerned about the 180 days. Would Governor Wolf, given the circumstances right now, consider waiving that 180 days just for the health of everyone and the safety of the children?
Lisa, what school district are you in?
Springford.
Springford. Okay, great.
I think the best thing I can tell you is that as recently as yesterday, we had a 6-hour workshop followed by a 2.5-hour tabletop exercise. At the tabletop exercise were all of the cabinet members. So that included various, I think it was the secretary from the Department of Education. What I can say is, speaking to educational initiatives or what's in Governor Wolf's mind would really be a misstatement at this point. But what I can tell you is this. Every single option at slowing down the spread of this disease and controlling it is being examined and weighed right now by this administration. And as has been echoed by others on this call, we are looking out for the public's health. So I can say that I can't tell you a definitive yes or no. What I can tell you is that this is an extremely serious public health issue, and we are taking it extremely seriously.
And, I'm sure that the state representatives will pass your question along to the governor and his administration, and I will tell you that we will do the exact same thing, Lisa. So I thank you for your question. Neil, you're going to be our final question.
Yes, good evening. This is Neil in Ballackinwood. First of all, let me thank you for doing this town hall. It's been very informative and helpful, and I really appreciate it for all the panelists. And my question tonight is actually my son's question. I'm sitting here listening to this with my 11-year-old son, Benjamin, and Benjamin has a question for the panel. I think it would be good for Dr. Gerberding or anyone else who wants to address it.
Hi, I'm Ben, and my question is, where did the coronavirus start and why?
Oh, thank you, Ben. It's an amazing story, really, but by examining the virus itself and comparing it to coronaviruses that we know about in nature, it's pretty clear that the source of this coronavirus originally was probably in a bat. It's very similar to the coronavirus that caused the outbreak in 2003, the SARS outbreak, in the same family. What happens in China and in many other parts of the world that don't have good refrigeration, people go to markets to buy their food, but because there isn't refrigeration, they buy their protein from living animals. And in this case, they're called live markets because it means the animals there are living instead of the kind of meat we get in our grocery stores that's in the refrigerator. And so when people are in these markets handling and picking out their food, or when they bring these live animals home and have to kill them at home before they're prepared for eating, of course any virus or any infection that an animal has is able to be passed to people. And usually it doesn't matter because most animal viruses don't infect people, but sometimes they do. And it turns out that viruses that inhabit bats are especially able to inhabit people, and we don't really understand exactly why that is, but that's been the case with even things like Ebola and other viruses that you might have heard of. So in the case of this coronavirus, probably the bat virus got passed on to some other animal that was in the market, and over time people just came in contact with these infected animals, and there was spillover from the animal into people, and then once people had it, they started transmitting it from one person to another. Does that answer your question, Ben?
Yes, thank you.
Ben, how old are you?
11.
Oh, my goodness. I'm so glad, Neil and Ben, that you were our final question, because that was a mighty smart, thoughtful question, Ben. Thanks for being on the line tonight. It's very cool. Now I'd like to ask each of our participants to just make a very quick closing statement, and I'll end it by telling you how we will stay in touch with you. But let me thank Dr. Val Arkoosh, Mark Ross, Ray I'm messing up your name, excuse me, Barishansky, Sharon Watkins, and Dr. Gerberding. So, Val, would you begin the close?
Sure. Well, thank you, Congresswoman, and thanks to everybody who took the time to listen tonight. I just want to end by reminding everyone that we are prepared for this. We were anticipating that this disease would come to Pennsylvania, and to reassure everyone that 80% of the people that get this disease have very, very mild symptoms. You can take some very simple preparatory steps, and to get more information and to stay up to date on exactly what's happening here in Montgomery County, you can go to montcopa.org, and halfway down the page there's a link to coronavirus update, and that information is all there in one place for you. Very easy to read and digest.
Thank you, Val. Vice President Ross.
Thank you, Representative, for this call tonight and the opportunity to speak to the constituents. I want to stress again, healthcare in this region, in Pennsylvania, is prepared. We have been preparing for these type of things. We are working together closely. Please use those common sense factors. Stay at home if you're not feeling well. Wash your hands a lot. Sneeze. Social distancing. And remember, do not contact your provider if you are feeling ill. Do not go right to the hospital. We want to make sure that our healthcare systems are able to deliver that world-class care that we do every single day. Thank you, Representative.
Thank you. And from the Pennsylvania Department of Health, both Ray and Sharon, if you're still on the line.
We are. Just wanted to say thank you, both to you for pulling this together and also to your audience for calling in tonight. To echo some of the earlier sentiments, remember, go to the CDC's website or the Department of Health's website. That's health.pa.gov. Remember, we have been preparing with this, just like Mark said, with HAP, with our county municipal health departments, within all of our bureaus here, and we have been preparing. This is not unexpected. Again, don't panic, but just prepare. And one last thing, and this goes to that young man with the last question, please always remain inquisitive. Thank you.
That's absolutely right. Sharon, did you want to add?
No, thank you so much for this opportunity. I think it's always great to be able to answer questions and really address concerns of the community. The only thing I would really like to say is that public health is perhaps one of the most unseen infrastructures in government, and we are working daily, long hours to make sure that contact tracing and all the other steps are taken to prevent further spread of the disease as much as we can, and we really appreciate Montgomery's help in that, and we've been good partners, as has been said. So thank you again.
Terrific. Dr. Gerberding?
Thank you. This has been very informative for me and a reality check, and I really admire the spirit of this town hall, so thank you for letting me join. I think when I'm listening to the questions and understanding how stressful this is for people at the community level, because we're just experiencing this for the first time, I just want to send a message of confidence and reassurance to people. You've heard from a really outstanding cascade of public health leaders who are on the job here. Your government in Washington is on the job looking out for the most vulnerable people who need food and help with salary support if they have to stay home, being ill or in quarantine, etc. So everything that can be done is being done. And I think all of us just have to kind of take a deep breath and realize we've been through some pretty rough outbreaks before. We had a pandemic in 2009, influenza. We made it through that fine. The early days are the hardest, but if we just kind of stick together and use common sense, we'll get through this one too. Most of us are going to sail through it without a problem, and we just have to work hard to protect the more vulnerable people in our communities to make sure that they have the same chance to have a good outcome from all of this. So thank you for this, and thank you for caring enough to participate in the town hall. I think it's just terrific.
I'll echo your words. I do thank everybody for participating, and I've been thinking about over the course of the last couple of weeks that there is an upside to this terrible virus. It's a healthy reminder of how interconnected we all are, and so I was really delighted to have the chance to have this conversation with all of you, constituents and experts and government leaders. I believe that through our interconnectedness that we can tackle this and any other problem with humanity and heart and common sense. And so I promise to continue to keep you updated through our website. Please send in your questions, and I'll forward them on to experts in the field. As this is a changing event day by day, I thank all of you for working together for the safety of our communities. And with that, I wish everybody a good night.
Thank you.
Thanks.